Kia ora koutou. Welcome back to the start of our first official session. I have the absolute pleasure of introducing you to our keynote this morning, Professor Sue Kringle, who is Ngai Tahu Kati Mamoe and Waitaha. And over the years, I've had the absolute pleasure of being able to work with her, steal her good ideas, and learn from her incredible portfolio of publications, as I'm sure many of you in the room have. Sue completed her MBCHB, her MPH, and her PhD, and I remember it was a really horrible experience to sit with her in Kauai as she was trying to finish writing her PhD. And she did all those amazing degrees at the University of Auckland. She is vocationally registered as both a general practitioner and a public health medicine specialist. And she's, I know she doesn't look it, but she's had a couple of decades in the Māori health research field. Her work focuses on the inequities of health, health service research, quality of care, child and youth health, cardiovascular disease, and she's doing the most amazing work at the moment in lung cancer screening. So please, can we have a big paki for Professor Kringle? Kia ora.
Thanks, Suze. I te mea tuatahi, he mihi kia mārino, nāna I whakatuwhera tō tātou hui I te atanei, tēnā koe. E tino tautoko ahau te kōrero o mārino, rawa ko Suze, mō ki Tuheitia. He mihi nui ki ngā tangata whenua o tēnei wahi, tēnā koutou. Huri noa kia koutou katoa, ko taimai I roto I te kaupapa o te rā, tēnā koutou, tēnā tātou katoa. So I've been asked to speak to you about translational research, and I have a very pragmatic definition of translational research, which is that translational research takes research findings where we know that there's, for example, evidence-based interventions and makes sure that they get implemented. And it is a big problem, having effective evidence-based interventions implemented, not only in Aotearoa, but I think that it's and I'm going to say a Western kind of problem, because I think that's probably where a lot of the research is done, but we don't see things implemented. And a very good example is around cardiovascular disease risk assessment and management. The research that was done on those matters, on identifying cardiovascular disease risk factors, was done in the 50s and 60s in a place called Framingham in the US. It's called the Framingham study. But it was not, so I was a GP in West Auckland in the early and mid-1990s. And at some point in that time frame, the National Heart Foundation put out a little card that we could use that helped us do risk assessment with patients that were coming to see us. And so we could classify them as high, medium, and low risk, and have a conversation with them about what we could do to reduce their risk of cardiovascular disease. So that was, 30 years later. And today, 30 years after that, we still find that cardiovascular disease risk assessment is not universally done, and risk management is even less done well. And so really, and to my way of thinking, that's a really good example of how we don't manage to translate research findings into clinical practice, particularly in a kind of highly effective way. So the projects that I'm going to talk to you about today is a project that myself and an amazing team of people have worked on, and I want to particularly acknowledge Karen Bartholomew and in particular Michelle Lambert. Michelle Lambert was the project fellow, manager and research fellow for this project, and essentially she was the person that made it all happen. On the right is the list of the other investigators that were part of the research. And we also had a lot of guidance from Kāhui and from an advisory group, kind of more of a health advisory group, as well as our Kāhui, consumer advisory group, as well as our Kāhui. And they usually met at the same time, actually. I mean, this won't be news to you, but I just want to kind of give us a reminder about why health inequities are important. So on this slide, excuse me, there is on the left, this is life expectancy from 2001 through 2020, 2022 by ethnicity. The Māori ethnicity is, life expectancy is the bluish line right down here, lowest life expectancy, Pacific above that. The good news in this graph is that life expectancy has increased for all of us over time. On the right-hand side at the top is the difference in the life expectancy gap between Māori and non-Māori, non-Pacific people at the top, and between Pacific people and non-Māori, non-Pacific people. You can see that the life expectancy gap has reduced over time, particularly for Māori, perhaps a little less convincingly for Pacific people. Oh, sorry, the end of that graph is covered up by the rest of the screens. And then at the bottom, we can see life expectancy for non-Māori in the purple and for non-Māori, non-Pacific people in the dotted blue line at the top by deprivation quintile. And so you can see very clearly that by deprivation, I wonder if I can get rid of this. There we go. So that by deprivation, life expectancy reduces for both Māori and non-Māori, non-Pacific people, but the gradient is greater for Māori. So the loss of life expectancy with increasing deprivation is greater, is higher for Māori. And it's these kind of things that drive us to make sure that we not only manage to translate research into practice and into the health system, but also that we make sure that these interventions are implemented inequitably. We know, we understand, I'm talking we, the research team, understand that most people in the health system want to do the right thing, and they want to have conversations about equity and how to address inequities, but often people get stuck on the how and on actually implementing and taking action on the how. And there can be many, many reasons that that happens, including political environments, which can make it difficult. But I think that, you know, there's opportunity for things to happen, you know, to continue to happen despite the current political environment. The other thing that we were aware of is that those interventions that were being implemented were still being implemented in a way that we had inequitable outcomes. And so Nina later is going to talk about bowel screening. And I think that that's a very good example of inequitable implementation for a number of reasons. And so what we wanted to do was to develop some tools to support mainstream services to implement interventions in an equitable way. We wanted the tools to be tailored for our context. And we were very interested in using implementation science as the methodology for this project. Implementation science is the study of ways to implement interventions and the development of implementation pathways and the evaluation of those pathways. So pass on again. So in this slide, you can see really that there are three broad questions when you're looking at interventions. This is here, I think, in this black pre-intervention box. This is the phase where the intervention is developed. So our starting position in this project was that we had an intervention. It had been demonstrated to be effective, and it had been demonstrated that it was good quality and effective for Māori. And then there's the three types of research. So firstly, there's could a program work? And that's your early stage, what we call efficacy studies. So things like clinical trials. And that's kind of in a very structured setting. Then there is, and they answer, yes, it could, yes, it does work. Or yes, it could work. And then does it work? Does it work in the real world context, which are effectiveness studies? And they can tell us, yep, it does work in the real world context. And then you get into how do we make it work well? And that's implementation science. And you can see here, it talks about dissemination and implementation studies. So this is implementation science. And you can see that you go through a range of activities in terms of developing implementation pathways and processes, implementing it, sustainability, and evaluating it along the way. So the implementation strategies are the how to implement. And that tells us what we consider when we're developing implementation strategies, what actions and efforts are needed to change the behaviour at patient, provider, system or policy level to support the successful implementation of an intervention. And we use what in implementation science jargon is called theories, models and frameworks, or TMFs. And research design and methods to guide the work of implementation science and to guide the work of implementing an intervention. Our project was funded by the Healthier Lives National Science Challenge, and we're very grateful to them for their financial and all the other support they've given this project. There was 3 phases to the project. So in the first phase, we did a scoping literature review. We did some interviews with stakeholders, so research end users and researchers. And we did our workshops with our kahui and community advisors. And from there, we went on to decide that we wanted to develop an equity-focused implementation science framework for Aotearoa, and that we would need what we called an equity readiness assessment tool, or the ERAT. And we developed a theory of change as well. But the 2 tools were the framework and the ERAT. The equity readiness assessment tool, I'll talk about in a slightly more detail, but that's really a tool to work out what the current situation is in terms of being able to implement intervention equitably in your context, and what might need to have to change to support successful, equitable implementation. The framework is to actually help you design an intervention pathway and to implement it, to monitor its implementation, and then to assess the outcomes of that implementation. Once we'd done that, we moved into phase 2, where we tested the ERAT in particular, not only amongst people who are working in one of our lung cancer screening projects, but also with other teams in Te Whatuora who are working in equity-focused projects. We did a bit of revision and refinement, developed a user guide for both tools, and we're now in the process of disseminating the findings, including developing a website, which we're meeting next week to sign it off, so it should be live very shortly. So the framework is called the Framework for Effective and Equitable Implementation in Aotearoa, or FREA. I know, such an easy, we just call it FREA. And you'll see, you know, if you look into implementation science, you'll see that, you know, there's lots of theories and models and frameworks, and they've all got acronyms. And so, yeah, it's an interesting area. So in our development of the framework, as I said, we did our literature review and we were specifically interested in equity-focused theories, models, and frameworks, our interviews. And then at that point, we paused and we thought, do we want to design a new framework, you know, never been done before, or is there one that we could base it on and refine it so that it was suitable for the Aotearoa context? And we chose to do that. We chose to use an existing framework and refine it for our context. So we adapted it, and then we took the themes from our research and we looked at the adapted framework, and actually those research themes kind of really guided the adaptation process. Had some consultation around what the framework looked like, and then did another iterative revision based on the consultation. So in the scoping review, we found 15 theories, models, and frameworks where equity was considered, but 12 where it was directly included. And so on the right-hand side of the screen, you can see here that these are the theoretical approaches used in implementation science for these TMFs, theories, models, and frameworks. The first grouping are what we call process models. And so what they do is provide guidance on the process of translating research into practice. Then we have what we call frameworks that understand or explain what influences implementation outcomes. And they can be determinant frameworks, classic theories, and classic theories and implementation theories. And then the final grouping is evaluation, and that is about evaluation frameworks. So some examples are our new framework is a process framework. Picking a Waiora, which is another New Zealand implementation science framework. It's specifically for use with Māori communities. It's got a co-design component, but it really is a determinant implementation science framework alongside the co-design component. And then REAIM 2, and I don't know if there's anyone here who's familiar with implementation science frameworks, but REAIM 2 is an evaluation framework. And there's and you can see the reference to our literature review just at the bottom left there. And these are just some examples from our literature review. So these are process, determinant, those three different types of determinant. That's implementation theory. Oh no, so yes, oh sorry, what am I talking about? Determinant, implementation theory, and then evaluation. And we had one that we couldn't categorize in either way, and so we called it a hybrid. The ones in orange are ones that are established and quite widely used, and the ones in grey are newer or adapted from some of the earlier existing ones, and that includes our own, and we based ours on this one, EquiIR, which is an equity-focused implementation research for health programs. We wrote to the authors and sought their consent to adapt it. So this is our framework, and you can see a few things here. So in the middle are whānau, and whānau health aspirations and needs. Of course, the Te Tiriti underpins everything. And then round here are contextual factors that are critical to implementation, and that you need to consider. And then there are 4 sections as you move from left to right around the cycle. The first section is around planning your implementation, and that includes specific consideration of the contextual factors that might affect implementation or that will affect implementation. Then the second phase is designing the implementation pathway. Implementation monitoring and outcome and evaluation is the last section. And then if necessary, you can think, oh, well, we've got to tweak the implementation a little bit. And so around the circle, you go again. I would comment here that when you're using implementation science, if you've got an intervention, you can actually use you can actually say, actually, I want to use a determinant framework to help with our implementation planning, but we're going to use a process framework as well. So you can pick different types of frameworks to support different parts of the process of developing an implementation pathway and measuring it. The reference there is for the paper about our framework. So just moving on to the readiness assessment tool. I think I called it the Equity Readiness Assessment Tool, which is what we were calling it until we settled on a framework name. So now it's been rechristened the FREA Readiness Assessment Tool. And as I noted earlier, we'd identified that actually we needed a tool to help people think about how to implement an intervention equitably and how to do equity work within their health services. Organisational readiness is a really well-described concept. It comes from, I think, organisational psychology, but it's also used in quality work and in a couple of other contexts as well. And really what you're trying to ask by looking at organisational readiness is, are we ready to roll out the interventional project? And if we find things that mean that we're not, what can we do to address those? We did another literature search and identified that the Wandersman Centre's readiness thinking tool was the basis of a tool that we wanted to adapt to meet our requirements here. So what it does is it helps staff to think about the intervention and about equity in 3 levels: personally, within your team or service, and organisationally. The personal components are really important because I've been in situations where there have been people in teams who don't want to do something and often don't reflect on what it is that's going on, and that actually makes it really difficult for you to progress your work. And likewise, if you're a team in a service and you're trying to do something, but there's organisational barriers, then that also makes it difficult. So important to consider all 3 of those aspects. Each team member does an online survey. It's pretty quick and simple, and there's 31 self-rated items. They're Likert scales, so it is very quick for people to do. The website generates the results for individuals and collectively for the whole team, and sends those back, the individual ones to the individual and the team ones, which are anonymised to everyone in the team as well. And they then go on to have a facilitated discussion within the team who are planning to implement the intervention. And if they find any areas where that are kind of orange or red flags to equitable implementation, then they can create an action plan to address those. Here's an example from the website, and the top, on the bottom right is some of the questions relating to individual readiness. And you can see that simple, like it, scale, and then people just click on and progress to the next section. We've developed 2 key tools for use in mainstream services. We've developed these tools because we want to move from lack of implementation or delayed implementation or ad hoc implementation of interventions to action and changes that mean that we get equitable implementation and a reduction in inequities and health gains for everyone. Our website, just as I said, will be up very soon. And one of the things, so in our research project, we had people, 2 people doing the facilitation, but we're looking into developing a train the trainer package so that there's capacity to do the facilitation wherever people are wanting to use the tools. Kia ora. E te hau.
Kia ora, Sue. There's something about the way Freya is spelt that just makes you want to go Freya, because it's like shouting, because it's in big letters. So will that be a free resource? Oh, we love free stuff. There you go. You heard it here first. Free stuff online coming next to you.
And heaps of resources on the website as well.
Thank you. Kia ora National Science Challenge. That's amazing. Thank you. There will be time to ask Professor Krengle discussion around the implementation science during the panel discussion.